In this course, we're going to cover three different types of descriptive epidemiologic studies. The first one is case reports. We'll also cover case series, and then we'll also talk about cross-sectional studies. A case report is an account of a single occurrence of a noteworthy health-related incident or of a small collection of events. A case report is a detailed report of the symptoms, the signs, the diagnosis, the treatment, and follow-up of an individual patient or a small group of patients. They typically, in health, they describe some sort of unusual or novel occurrence that clinicians are often, or public health officials are often trying to document in terms of a case report. Your textbook gives you some interesting examples. They talk about bison encounters in Yellowstone National Park. There's also the example of adverse reactions due to cosmetic surgery in the US and imported rabid dogs. A little more relevant to public health, I have a screenshot here of an abstract from a case report that was published kind of early on in the COVID-19 pandemic, and these were really important really early on during the initial COVID outbreaks that were happening. So in this specific example, the authors here have basically described kind of a collection of four patients, so less than a handful. They've described four patients in terms of their diagnosis of COVID-19. So they describe the patients, they talk about how the diagnosis was made in order to kind of help clinicians in the future understand this small collection of people and how their diagnosis how those clinicians could then use this information to diagnose patients later on. This is kind of initially in COVID, this was, we saw a lot of these, they were like the initial publications of this is what's going on. We're seeing these like unusual respiratory viruses. We have to document what we're seeing. So again, a case report, it would be the documentation of some single occurrence that appeared in a clinical setting or of small collection of occurrences. In this example, they document 4 patients and describe them in this case report. A case series is different from a case report. A case series is more of a larger collection of cases of disease. They're often grouped consecutively and list common features. A case series is a descriptive study that typically follows a group of patients who have a similar diagnosis or who are undergoing the same procedure over a certain period of time. Your textbook gives you this example of reported cases of primary meningoencephalitis between 1937 and 2007, and talks about the primary exposure source being fresh water in lakes and rivers. To make this a little more relevant to public health, I have included a screenshot of a case series that was published early on in the COVID pandemic. If some of you remember, we had this large outbreak that happened in the Seattle region earlier on in the pandemic. Early in 2020, and this was documented and published in this case series. So the authors of this, they identified patients from different Seattle area hospitals who were admitted to the ICU with confirmed COVID infections, and they obtained clinical data through their medical records, and they published this information on patients. They had 14 days of follow-up data. So these people were basically followed and their information was published over this 14-day period. And this particular case series included 24 patients with confirmed COVID-19. So a much larger number than something you would see, for example, in like a case report. A case series is going to have a much larger collection of individuals and can in particular can follow those individuals over time and describe symptoms and other characteristics of those individuals. And then the last descriptive epidemiological study we will cover is cross-sectional studies. Cross-sectional studies, you hopefully remember from Health 298. They are very, very common in health research. What they do is they examine the relationship between diseases or other health-related characteristics and any other variable of interest as they exist in a particular population at one given point in time. We refer to these oftentimes as prevalence studies because that's exactly what they're measuring. These studies are examining variables at one point in time, and when you're sampling a population and collecting information on a given disease, you can then get that data and estimate what percent of that population from your sample, what percent has whatever the disease is, so you can estimate the prevalence of a health condition or disease through cross-sectional studies. That's why we often call them prevalence studies. For these particular studies, we are assessing the exposure of interest and the outcome at the same point in time. So for example, if I am looking at lung cancer and smoking, I would assess the presence of lung cancer and the presence of smoking status, whether someone smokes or not. I would assess those at one point in time. So I wanted to show you an example of how useful these were during COVID and have been during COVID. These are very popular study designs that are used for various reasons. One being that they're pretty easy to administer, just a one-time survey, and they can often be relatively inexpensive. So this was a paper published by individuals during COVID-19, and they wanted to look at factors that were associated with wearing a mask among adults. We tried to get adults to wear masks early on in the pandemic and faced a lot of challenges with that in the public health arena. And so this particular survey used a cross-sectional study design to look at what factors were associated with wearing a mask among adults in the United States. This internet survey sampled just over 500 adults between April 7th through 9th, and it asked about their use of a cloth face covering or a mask, and also asked about different behavioral and socio-demographic factors that might be associated with adherence to wearing a mask.